Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the front lines of healthcare. I'm your host, Dr. Brianne Wilson, and I'm thrilled you're here. Whether you're a healthcare professional, someone passionate about wellness, or someone who's looking to gain more knowledge about your own health and well-being, you'll find stories here that resonate, educate, and inspire. This podcast was born from a shared truth. Healing isn't just about medicine. It's about connection, listening, and leadership. As always, our disclaimer, the information shared on Healing with Her is intended for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by the hosts and guests are their own and do not necessarily reflect those of their institutions or employers. And now, without further ado, we have a special guest here, the first male on Healing with Her, Dr. Jonathan Lee. The title of this episode is The Power of the Pill, A Conversation with Pharmacist. And so Dr. Jonathan Lee is a retail pharmacist with 10 years of experience, turning underperforming teams into top performers. Known for explaining medications in plain English, he bridges the gap between complex healthcare and real-world understanding. And so before I have Jonathan talk, I want to introduce our other Healing with Her members.
Hello, everyone. My name is Dr. Pamela Reed. I'm a retired internist, having practiced primary care for 30 years.
And hello, my name is Dr. Teresa Rush. I'm a practicing OB/GYN with Audubon Women's Medical Associates, and I've been practicing over 30 years also.
All right, so Jonathan, Dr. Lee, talk to us. Talk to us about your pursuit of pharmacy.
My name is Dr. Jonathan Lee. First, I just want to thank you guys for being on the podcast and being able to talk to you guys. I had reached out to Dr. Wilson because I am working on just an outreach. I want to make sure that patients are able to get the information they need, be informed as possible. And when it comes to medications, it can be very tricky. The navigation of the healthcare system is crazy. Things can be expensive. So I try to break down everything in very simple language, very much layman's terms, so everybody can explain it. So thank you guys. Healing with Her definitely matches the brand that I'm trying to reach to my audience. So thank you guys for this opportunity. I've been a pharmacist since 2012, graduated from Xavier University of Louisiana, Gold Rush, yes. So was in Louisiana for a while, initially worked for Walmart Pharmacy, moved over to CVS Pharmacy, and I've been able to have the privilege recently to actually work with pet medication. So I help pet parents, and I'm able to basically deliver pet medications all over the U.S. right now. But I would say the biggest thing that I have with just pharmacy in general and some of the solutions that we come across is just overall cost. Sometimes when it comes to storing medications, as we talked about earlier, I'm going to be having a weekly newsletter. And one of the big topics that we talk about initially is just storing things like insulin, something that costs tons of money, options on how to get lower priced insulins. And one of the big things that a lot of customers come to me about is that they'll easily, especially in the summertime, leave their insulin pens in the car, and it can get destroyed very quickly. But besides that, been working at retail for a long time. The one thing I try to also get to some of my colleagues is pharmacy is not just medications. It's the people you talk to, the people you work with, building high-performing teams is hard work. After you've been through school for 10, 12 years, a lot of the medicine part is easy. But working with people is not so easy. So that's my biggest thing. I would say just in my 10 years of pharmacy and working in this part of healthcare. And then also the collaboration that it comes with doctors and other healthcare professionals. I think sometimes all of us as healthcare professionals can do better at communicating with each other and bringing that piece together.
So one thing and I'm sure Dr. Rush and Dr. Reed can agree that can kind of get under my skin a little bit, is when a new patient comes to the office and you have them write their medication list down. And they'll be like, oh, I'll take the blue one. I mean, and the little orange one. And the little pink one. Or they have no idea exactly what medications that they're taking. And it's like, it can affect like how we would treat them because, you know, as you'll talk about later, how medications can interact with different things. And if I don't know what you're on, or if they don't know their allergies, things like that. So what advice can you give to help to the patients, to help us, to help treat them better, if I'm making sense, if you know what I mean?
I would say the first thing, just patients do have to advocate for themselves. If you are going to the doctor and they write you a prescription and maybe if it wasn't discussed well, ask questions. Know what you're taking. When you come to the pharmacy, come ready with questions as well. Why am I taking this? How often should I be taking it? I would say the biggest thing with our technology, most pharmacies have apps to where you can have all of your medications on the app. So you log in. The initial problem is logging in. Most people don't like it initially because it is difficult. We have to have extra layers of security for HIPAA reasons. So it does take a little bit longer, but when it is there, it's there. We have all of your immunization records. We have all of your medications. And then even if you don't want to do the app, just take a picture of your medications that you're taking most often. So you don't have to go off memory. You don't have to remember that list or that notebook. You've got your phone with you all the time.
So one of my husband is an internist, and one of the analogies he gives his patients when they say, I'm taking that little blue pill or I'm taking that little yellow pill, is he would say to them, that's like me telling you I drive that red car.
Yes. Yes.
So
good.
let's have you understand the make and the model. So he tries to give them an analogy and then help them kind of say, okay, so this is the make and this is the model, right? So this is the name and this is the dose. And then to go further and to this is why I'm taking it. Like this is what this medication is for. And so he tries to help them by giving them analogies to kind of get people to understand the need to really understand what that medication is, the dose that they're taking, how they're taking it, and what it's for.
I think the other thing is the one thing I do say, at least for the advocate for patients, sometimes those medications are just hard to stay. And I've been literally going to school for pharmacy. Sometimes I can't even see them. And if it's a new drug that just came out on the market, I'm like,
Absolutely.
okay. But no, I guess.
Yeah, I think that especially some of our patients are taking 15, 18, they take a lot of pills. So obviously if we can try to get our patients to use apps, obviously we know we have some older who are just like, I'm not going to do it. And then in that case, have a list. I love my patients who come in with a list. And they'll come in with a whole paper, but at least they have a list.
Yes.
They have the name, the dosage, when they should take it, that is golden.
Yeah. And I used to have patients ask me at the end of an appointment, can you print my medication list? And everyone now has an electronic medical record, right?
Right.
Every doctor's office has one. And so to have patients advocate for, please give me that list, because the doctor may have increased something, decreased something, discontinued something. And now at the end of the visit, to have them just say, can I have a medication list, so that they take that with them and absolutely take a picture of it.
Yeah, that really does help. I had a patient who came in for surgery, and she just whipped out her phone and she had everything listed, which was really helpful for us to get her processed through pre-admissions. But it's also kind of, I love to see when they come in with a list, and yes, the names are really out there, but I love it when they have what's it for, you know, my water pill, my, you know, whatever they'll call it, and then how often that they're taking it. And then usually they may have their doctors listed on there. Just, it would be helpful if we had any questions about it. But I'm not really sure how we do this in the office, but they can sign up for something that will allow us over the last 6 months to know what they are taking. So I'll have someone who's kind of like, really kind of, I'm not really sure. And then if you go into the current med list, you hit the button at the import list, and it'll bring up all of the medications that they have been on for the last 6 months at least. And that really is helpful to me, because a lot of times they'll go, oh yeah, I forgot about that one.
Yeah, yeah. So talk to us about how you as a pharmacist can help support patient care. Like what role do you play? Like if a patient comes to the pharmacy, or how are you?
So I would say number one, the biggest thing right now, and pharmacies are just pushing it everywhere, is we want every single person to be vaccinated. So I currently practice in the state of Texas, and pharmacists can basically give any vaccine. Even when we had that a small outbreak of monkeypox, we had the vaccines at the pharmacy. I think as far as pharmacists, we are kind of the front line to healthcare. A pharmacist is very easily accessible. You can just come to the pharmacy. I think a big part of our job is to basically say, okay, this is something you can take care of at home, or no, you need to go to the doctor. You need to go to the doctor right now, or you need to go to the emergency room right now. So I think that is a big piece that I think is really important as far as pharmacy goes. And then when just counseling patients on certain medications, making sure dosing is correcting. Sometimes, you know, we get newer doctors, or if you get, I remember one time we had a new doctor had a cephalexin for like a 2-year-old, and they made a mistake and dosed it off of pounds instead of kilograms. So it was a super high dose. Called the doctor, of course, got everything taken care of, but you know, sometimes we're that last line of from doctor to getting the medication to the patient. So I think that's a big piece of it. So I would say number one, also the other thing I also like to put is that adherence is a big thing for us in pharmacy. So we do a lot to make sure we send text messages to patients to make sure they remember to pick up their medications. We like to do auto refills. Sometimes we even, certain companies can make it to where if you're getting multiple medications at different times, we can merge them so you can only come to the pharmacy at once. We do deliveries. We try to make sure to make it as easy as possible for patients to get their medications on time and to take it in a timely manner. So I would say adherence, immunizations are like biggest things, dosing.
So one thing I kind of, you know, I have with patients too, are patients who, let's say they come into my office for an infected ingrown toenail, and I want to put them on an antibiotic, and then they come for follow-up, but they haven't taken all of the antibiotic. They stopped taking it when they felt like it looked better so that they can save some for later. And I feel like, I mean, I don't know what you doctors have experienced, but
so I would say probably that is I would say one of our biggest myths as far as pharmacy, and people thinking as soon as they feel better that they can stop taking the dose. That is the easiest way to build these super infections or drug-resistant bacteria. You gotta take the entire dose. Even if you start to feel better, if you have, usually people start to feel better between 3 and 4 days of the dose. like minor cases like strep, things like that. But if you do not take it, you're going to come back to the pharmacy and you're going to get a more powerful medication, but it's probably going to have more side effects. You don't want that. So finish out the dose. So that's probably the biggest myth that we have when it comes to medications.
How about you, ladies? You experience any of that in your practices, as far as like any other medications with people thinking they can doctor it on their own?
I think sometimes the problem is from us not doing our job well as providers, right? And not having patients understand, I started you on this blood pressure medication. Just because it ends in 30 days doesn't mean that it was just for 30 days, right? To have that conversation that this is something that you may be on lifelong, and so there are refills, right? And it's because sometimes people think, I got the bottle, there were 30 days worth, I took all 30 days, I'm good, not knowing that they should continue. And so some of it's definitely on our part in terms of educating patients about the length of time they need to take a particular medication and being clear about the instructions on how to take it, especially for medications also that are maybe just like once a week or once every other week, to be clear that just once a week, right? Because people are used to taking it every single day. So it's like being very clear in your instructions.
And probably repeating things. Because I'll say, and I'm quite sure my patients kind of go, okay, I got it. And I'm like, no, you don't. And I will have them repeat it back to me. Now, how are you going to take this? When are you going to start it? When is it completed? Making sure that they realize that some medications, especially that are going to be long-term, you may not feel the greatest when you first start it. But your body can acclimate to that. Mm-hmm. And if there's any questions, either call or portal us. Just don't stop it, and don't come back in 2 to 3 months when we have you in for follow-up, and they're like going, I didn't like that medication, so I stopped it a while ago. And I'm like, okay. So we've got to start all over again. Mm-hmm. So
I would say that another thing that we get a lot in the pharmacy is sometimes we have really good patients, and the misconception that we are so busy that we can't answer questions. No, please ask the questions, because it's probably going to turn into a bigger problem later on if you don't ask us right now. So asking those questions. So in the state of Texas, we are required to counsel on every new prescription. So even if a patient's been on lisinopril for 30 years, just say, after a year, it expires, they get a new prescription for the same medication, I got to counsel them again. But just like you said, I've been taking this medicine for 20 years, and let's talk about it a little more. Okay, we're going to talk about it a little more. But that's some of the big things that, and we don't, even though we have so much technology, we don't always have the full picture. And the reason I say that is a big thing that comes up a lot is when a patient goes to different doctors for different reasons. So they may have, their primary care, and then they may have a specialist just for diabetes, or they may go to a podiatrist as well. And sometimes they don't always realize that some of these medications may overlap. I've had lots of times. I think the biggest one that we caught that could have been a huge problem is a patient was doing potassium 20 mil equivalents. It was like a big starting dose. They were taking 2 in the morning, 2 in the evening, and then their other practitioner called in the same thing. We'll talk about an overdose that would have been a problem.
Yeah.
So nobody has the full picture. I think always going over your patient's medications, making them read it back to you or have that plan of action is super important. But yeah.
That's a good story as far as because like I said before, sometimes these patients come in, and I have patients come in all the time as a new patient, and they don't bring their list. And then if I prescribe something that is going to counteract, and then EHRs are great now. If I have it, I can catch it. But if I don't, that's where the pharmacist and the pharmacy come into play. Like, no, you can't take that because you're already on this from somebody else. Let's talk about over-the-counter medications, right? People love to kind of doctor themselves. And I think, within reason, but not all over-the-counter medications can be just completely benign without any, consequences, if not taken correctly and for the correct reason, including things like supplements. So can you touch on that some?
I would say the first thing, I had a brief stint in college where I worked at a hospital. For all patients, if there is a gas station, please do not take pills from a gas station, okay? Most of those are not regulated. They will do damage in your kidneys and your liver. Don't do it. Don't do it. But honestly, some of the biggest things is making sure you read the active ingredients and not just the name of the drug. So if you do Tylenol, cold and sinus, I can tell you how many times people will take many different NSAIDs because they want a cough medicine and then they want to, something for their headache as well, not realizing that all of these are the same ingredients. And now you're overdosing on ibuprofen. Now you're in the hospital because you had a GI bleed. Making sure you read the active ingredients and know what's in the active ingredients. The other thing is sometimes I see people kind of overdo it on like multivitamins and supplements. And a lot of the times they have the same ingredients in them. So you don't need a multivitamin and you don't need an extra vitamin that's a gummy. And one is fine. One will do. You don't need to take all that extra stuff. I would say for over-the-counter medications, those are probably the biggest things that I see that becomes a problem. Always ask the pharmacist. You don't know what medications can interact with the prescriptions that you're taking. So one of the first things I normally ask is if you are taking any kind of OTC medications as soon as they come in. And I know we talked about it before. When it comes to a lot of the social media supplements and stuff like that, they'll tell you a little bit of everything. Just make sure you talk to your doctor. Make sure you talk to your pharmacist before you take any of these things. But yeah.
So when we were talking earlier about patients who may take 15, 20 pills a day, what advice can you give them about managing them properly and making sure that they're taking their medications correctly when they're taking so many?
When I'm taking so many, unfortunately, I usually sit down and we'll do consultations and we'll just write everything down on a piece of paper. So I go through all of the ones you can take in the morning, the ones you can take in the evening. Then I also try to do, certain things like habit stacking. Like if you normally, wake up in the morning with your morning coffee, it's not always the best sometimes, but it can get you to remember to take the medication. That's when you should do it.
Except for your Armour Thyroid, which I was taking
yes.
with my coffee, and it wasn't going to absorb, and so I was adjusting the dose, bad doctor, myself, and couldn't figure out why it was not working. So that's a very important point.
Alendronate, you got to take it completely by itself. Make sure you sit upright. But yes, I think also making sure you have a full meal before you take some of them, unless it specifically is contraindicated. Your stomach being able to digest and fully process all those medications, especially when it's a lot at one time, you got to basically get your stomach ready. So having that meal gets your stomach, it produces the acid in there that'll break down the medications a little bit better, especially when there's a lot of them. So
I love that advocacy of having patients who are taking multiple medications do a consultation with a pharmacist.
Yeah, I was going to say
I think that's like amazing. So put that in your next newsletter.
yes,
Is that something that would necessarily need to be like an appointment made, or can they just come in and?
They can just come in. Now, I will say if it's more than about 6 or 7, I would just tell the pharmacist when's a good time to come in.
Okay.
sometimes it can be lengthy to do that. And just to be honest with you, we still, we got things we got to do. People still need their medication. So if you come at a busier time, we will still help. You just may have to wait a little longer.
Okay.
But if you come at an appointed time and tell us, okay, 6 o'clock great for you, 6 o'clock is great, or can you come around 1 o'clock? I have another pharmacist here with me, and we can spend all our time just talking about that. But no, it is so helpful to have those people come in to counsel their medications. It just makes everything easier. You don't have to worry about any kind of interactions later, and it also builds that trust. So anytime you do have anything or any problems in the future, they know they can call you and they can talk to you about it, and it's never a problem. And I think that's sometimes the best, because it's not always easy to get to all your healthcare professionals. But usually you can always get in touch with a pharmacy, build that relationship.
And I don't think people realize that if they have like a cold or a sore throat and they want to take something over the counter, they can ask the pharmacist for a recommendation. Like, I don't think they realize that the pharmacist can actually help them choose the appropriate medication based on what's going on, and over-the-counter medication.
The one thing I will say, even when I talk to some of my patients, they'll say, "Oh, you look so busy." So I try to get them to understand. It may be a minute or two, but it's worth it. Just ask. It's better just to ask.
I love that idea of being able to help patients advocate for themselves in that way, like you said as well. If they're taking multiple medications, or if they're not feeling well, if you're at the pharmacy that you go to, they can easily pull up all of your records and see what you can take, what you would have access to, what won't make you sick, won't cause you to have a GI bleed, won't cause, don't drink that with your coffee, like all of these things that I wouldn't even think of. And to be honest, I don't really have to go to the doctor much, but I would never think to go to the pharmacist and ask for advice either. Which is funny because my dad, my brother, my mother-in-law, sister-in-law, all pharmacists.
All pharmacists.
All of them. I even worked in a pharmacy when I was younger, like as a mini pharmacy tech. So, couple rapid fire questions. Is it okay to crush a pill?
I would say never crush a pill unless you ask. There are multiple medications where if you break them, they will actually give you a much higher dose than you would expect. Just off the top of my head, something like Depakote, it is meant to take and swallow whole because it disperses through your body through a period of time. So if you break that or crush it, it's going to disperse a ton of medication all at once, and there's going to be a problem. So I would say no.
Is there a best time of day to take a vitamin?
I would usually say most vitamins you can take in the morning with breakfast. I would say certain ones like iron, I would say specifically with orange juice because the acidity helps you absorb it a little bit better, but most of them.
Okay, follow-up question to that. Are liquid vitamins better than solid vitamins?
No. The only reason liquid medications in general just work in the body faster. So if you wanted to take maybe a liquid ibuprofen because you're in a lot of pain, the onset of action would maybe be 10, 15 minutes, where a pill take about 30 minutes to work. So no. It's just some people the only reason pharmacists do different forms like that is just because people will not take the pills. Mm-hmm. We just give them different options. That's literally the only reason.
Are those who probably have gastric bypass or surgeries?
Yes.
Having something.
I would say, and then the other one is the only other time we do dosage forms in that reason is for an extended release. So they can just take one tablet a day instead of 3, 3 times a day. Or in special cases, like you said, their GI tract is just not big enough. So we have to be able to make sure it's absorbed in a much quicker time because they don't have as much GI.
Mm-hmm. Can expired meds be dangerous?
Most of the times, they are not dangerous. They're just less effective. But I would also not take them. Specifically, tetracycline is actually a very bad reaction if you take it afterwards. But most drugs, if they are expired, just means they're less effective. Still would not recommend taking them. But no, they are not.
All right, Dr. Lee, let's get your top 3 tips for medication safety.
Medication safety, top 3 tips. I'm going to say number 1, do not leave your medications in the bathroom. The humidity will degrade the medication, leave them in the kitchen. Anytime somebody has insulin, try your best to put it in a refrigerator in the center of the refrigerator. If you leave it in the door or if you leave it on the top or bottom, it's not as cold as you think it is. Most of the pens usually last well, but if you have a vial, it can degrade pretty quickly, and you have ineffective insulin, and you don't want that. I would say the last one is anytime you take a medication, I would really talk to your pharmacist or your doctor. There's so many new things on the market. There's so many things that are coming out there. Even I'm seeing more and more of the GLP-1s that they are trying to compound themselves, and it's wreaking havoc with people. So make sure you get it from someone you can trust. I would say those are big 3.
I love that. I thought those were great, especially the one about the insulin, putting it in the middle of the fridge.
Yeah.
And from our standpoint, from OBGYN, are certain birth controls like the NuvaRing. I have so many people who get them and they set them out in their cars. And I'm like going, it's heat activated. So if you're sitting it out in the car, it's already activated. So in your refrigerator until you're ready for it.
Yes.
Wow. So many things to learn. I love this.
Actually, because you said so, another OTC thing that some people don't know, St. John's wort actually decreases the effectiveness of birth control.
Wow.
Oh, I did not know
I
that.
didn't know that. Okay.
Look at Dr. Lee teaching us.
I know.
Love it.
I usually tell I when I'm going through the med list and I notice that they have antacid. I have so many patients in terms of vitamins. They take their antacid in the morning, and then they're taking their vitamins, and I'm like going, "Yeah, babe, that's not you know, sports."
Which is so these are like perfect reasons again to talk to your pharmacist about any medications you're taking over the counter or prescribed, so you can know that your medications are actually being effective and you're not counteracting them.
Dr. Lee, how long would you say they should wait if they are taking an antacid, or just take it at night, or just if they take it in the morning?
If they take the antacid in the morning and they're taking other medications, either they're going to have to take it an hour before, or unfortunately, it's going to have to be at least 4 hours after.
Okay. And then for our audience, just examples of antacids, because I don't necessarily know that people.
So Tums, and then you have Pepcid or famotidine. Some of the bigger ones like Nexium or Meprazole or Prilosec as it is over the counter. So there are a couple different brands. Yeah.
This has been amazing. Where can listeners find Dr. Lee?
So I am actually starting a new newsletter, and basically I think we're going to put that on there, but it's through a website that I have, askmedrlee.com, and I am also currently on LinkedIn, so Dr. Jonathan Lee, and then I am also on Instagram, Ask Me Dr. Lee.
Thank you so much. This brings us to the end of this episode of Healing with Her. We hope that you found the information enlightening and empowering, as I know I did. Please find a link on our Instagram, Healing with Her Podcast, for more resources on your medications. Please consult your doctor and or your local pharmacist. Again, our wonderful disclaimer: the information shared on Healing with Her is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare providers with any questions you may have regarding your health. The views expressed by the hosts and guests are their own and do not necessarily reflect those of their institutions or employers. Thank you.